Hello everyone. Today we'll discuss the three swab test. Okay, this is the test that used to for diagnosis. Three swab test used to diagnosis of vaginal fistula. Basically, the locations of fistula we have to detect with this test. This is the three swab test. What is the procedure for this test? Yeah, actually, the catheter you have to insert the catheter here. Okay, the catheter has to insert it into the bladder through the urethra. You have to insert around 50 to 100 ml methylene blue. Very important statement. Methylene blue has to be injected, and the next step is the you have to pack with three vaginal pack has to be given. One pack has at the level of vault, and the second pack has to be at the middle, and the third pack you can see this is at the vault and the middle part, and another one is just above your introitus. Okay, so this is the three swab test. You have to use three swab, one at the vault, one at the middle part of the vagina, and one at the just above the introitus. Okay, so basically in three swab test the catheter has to be introduced in the bladder. The catheter has to introduce the bladder through the urethra, and you have to inject 50 to 100 ml of methylene blue. You can see this is the methylene blue inside the bladder through urethra you have to introduce, and the three swab has to packed. Then now the interpretations, how you interpret whether it is a what are the type of fistula, the connection from the type of fistula. So basically how you will interpret this type of fistula, the part A, that is the uppermost part of swab. If the uppermost part of the swab, it very important, if the uppermost part of the swab get only not stained, if it is not stained, okay, if it is not stained and it only wet, because the methylene blue is injected into the bladder, it is not because of the vesico-ureter reflux. There will be because here the closest of ureter, so there will be no reflux into the ureter. Only the original urinary content, urinary flow has to be coming through this swab. Okay, so in this first swab, if it is a ureterovaginal fistula, basically remember, if it is a ureterovaginal fistula, if it is communicated to the ureter to the vaginal wall, that is the vault, then it will the only there will be a urine leakage will happen. There will be no methylene blue leakage will happen. So the swab only get wet, very want, it becomes wet, not stained with methylene blue. So that means this is confirmed that the leakage is directly from the ureter, not from the bladder or urethra, because the methylene blue has to be, because it is injected into the bladder, that because of absence of BUR in a normal patients, that will be cause if your ureter is communicated into the vaginal, the urine will directly come down and through this fistular tract, it is drained into the uppermost part of the swab, and urine become wet the swab, and it will not stain with any methylene blue. The next is point B, that is the middle part of the swab. If the middle swab gets stained, okay, because here if it is bladder fistula, okay, vesico-vaginal fistula, if it is directly coming to the bladder, then the middle part first stain, then it gradually, the most stained part will be the middle, then it will gradually stain the lower part also. Okay, so basically you have to remember, if it is a vesico-vaginal fistula, the middle part is more stained compared to the lower part of the swab. Okay, because the bladder is directly communicated to vesico-vaginal anterior vaginal wall, so that will cause middle part of the swab stain more compared to the lower part. Okay, so remember, then third is the point C, that is the urethrovaginal. If it is a urethrovaginal fistula, because the lowermost vaginal wall is lower part of the vaginal wall is communicated with the urethra. So if it is a urethral vaginal fistula, okay, so the vesical bleeds come down, and it is stain the lowermost part of the swab, it will not stain uppermost. So basically if it is lowermost part of the swab, if it is stained, then what is the diagnosis? That is the ureterovaginal fistula. So very simple, the leakage from the urethra seen in the ureterovaginal fistula. So it is urethra, this is BVF, and this is your ureterovaginal fistula. This is your vesicovaginal fistula. This is the ureterovaginal fistula. So remember, very simple tricks to remember. 3 swab test is usually diagnose any fistula's communicating tract to the urogenital tract to the vaginal wall. So in this test you have to inject, there has to use 3 swab, and amount 50 to 100 ml of methylene blue has to be injected into the bladder through the urethra. Methylene blue has been injected through the bladder into the urethra. Then you have to put 3 swab, one at the level of vault, one at the level middle part of vagina, one at the lower part of vagina. Okay, so middle upper part, basically you have to remember, the if it is a ureterovaginal fistula, there is the methylene blue is not going into the ureter. So ureterovaginal fistula, only the urine, normal urine is coming out through this tract, and it is drained to the uppermost part of the vagina. If it is a ureterovaginal fistula, then only urine with the swab, no stain. Very important, not stain, that means it is a ureterovaginal fistula. If it is a middle part of the swab is communicating with the bladder, that bladder vesicovaginal fistula. If it is a lower part of the swab is become stained, that is called ureterovaginal fistula. Very simple test to detect all these vaginal communications fistula tract to the urogenital tract. So very important question, they can ask any times in the NEET PC exam. So please remember, 3 swab test, simple test, 50 to 100 ml methylene blue, 3 swab, 1 uppermost, middle, lower, uppermost, no stained, only weight. Then it's ureterovaginal middle swab stained, then bladder fistula BVF lowermost part stained, then it's called ureterovaginal. Thank you. If you like this content, please subscribe. Thank you.